If you're having pain when walking, there's a couple quick little screening tools you can use to determine, is it coming from your hip or is it coming from your back? So knowing some anatomy can be helpful here. So generally speaking, joints, they don't like too much compression. They like to be more open, right? So for the neck, for example, when I side bend my head this way, this side is opening and this side is closing. So I would expect stretchy type discomfort on the opening side, but you shouldn't really feel much on the closing side. If the closing of the neck causes a little bit of irritation, that's the sign that the joint is irritated. So the same principles apply for the spine, the lower spine, and the hip. Now the hip, the ball and socket, when you open the hip this way as an external rotation, then that generally will make it feel better, generally. And closing it, or kind of locking it into internal rotation will usually irritate it. So one thing you can do is you can walk, right? And if it's reproducing your pain, try turn your foot out, right? So say it's my right hip, I'm turning my foot out and you can walk like that. Does the pain get better? If it does, that's a sign it's coming from your hip. Conversely, if you were to do the opposite, internally rotate, and that makes it worse, that's a pretty good sign that's coming from your hip. With the spine, closing is extension or leaning back, the vertebrae close together, whereas bending forward opens the vertebrae. So if you walk and you lean back and it hurts more, that's a good sign it's coming from your spine. Or does bending make it better? If rounding the spine and opening the spine makes you feel better, that's a good sign it's coming from your spine.